Today on the WellnessForHou podcast, I am chatting with Dr. Sebastian Bonilla.
Woo woo.
Not only a doctor of medicine, MD, but also a doctor of acupuncture and Chinese medicine, a DACM. So he knows both Western and Eastern medicine. He is originally from Ecuador, where he graduated from med school in 2014. He worked as a resident in hospital environments such as pediatrics, OBGYN, and internal medicine. After a couple of years, he decided to move to Houston. We are so lucky to obtain his Masters and Doctorate in Acupuncture and Chinese Medicine so that he can help people more on the preventative side. Now he works at Templ Wellness and occasionally other clinics where he helps our community heal stress and anxiety, aches, pain, and tension, hormones, and more. His focus niche is specifically pediatrics, sports medicine, and men's health. Sebastian is fluent in English and Spanish and even knows a little French, which we love because that expands the community in which he can help. Sebastian is incredibly knowledgeable and talented. He's witty and can always make you laugh. He's humble, caring, and might I say, handsome, because I'm blessed to also call him my boyfriend.
Aww.
Sebastian, thank you so much for all you do for the community and for me. How are you feeling?
Oh, well, you've done your homework. It's not like you live with someone like that. Oh, no, yeah, you do. Yes. So, well, thank you for inviting me. I always been proud of what you've done so far. And I'm excited to be finally here and share this vision that you've had since a long time. And I'd like to share this time with you. So happy to be here, happy to support, and loving you always.
Aw, thank you, Bebe. So I know everyone is excited that we finally got you on the podcast. So I'm just as excited as everybody else. And I wanted to start off with how we met because it was really special. So I'll tell what I remember, but feel free to chime in, okay?
Okay.
So I'm going to take us back to December 15th of 2021.
Okay, you got the day right.
When we were first starting doing pop-ups around town. So this was really the seeds of WellnessForHou. We were teaching yoga classes at Acupuncture, which is now Templ, where you work. And Dr. Sarah had a garden in the back, so we would do yoga and acupuncture. So that Wednesday night, we were doing a yoga and acupuncture, and I would invite people, Dr. Sarah would invite people. And so we had like 19 of the 20 people who had signed up there. And so I looked at Sarah and I said, "Hey, Sarah, are we waiting on anybody else?" And she goes, "We're waiting on my friend Sebastian. He's looking for love." And she walks away like she just said the most normal thing. And I was
Thank you, Sarah.
Yeah.
Okay.
I don't even know if she remembers this, but I was like, "Wait, what?" And I was mic'd up, so I couldn't really say anything. And my friends Michelle and Whitney were in the front row. And you walk in probably 30 seconds to a minute later, and I'm like, okay, well, he's tall, dark, and handsome, like Taylor Swift says. And I was like, I'm in trouble. And I look at both of them, like Michelle and Whitney, and they look back at me and they're mouthing, "Who is that?" And I'm mic'd up, ready to teach the class outside. And I'm like, I can't say anything.
I remember that. Yes. I remember when Sarah actually told me about it. I was actually looking at her Instagram and she was posting all these yogas and she was doing it in the yard. I'm like, okay, I'm going to support her. I might as well do something different because I was doing, the gym and playing tennis here and there. But I was like, let's try it. I haven't done yoga in a while. And to support a friend. So I asked her, "Hey, when's your next yoga that you're going to have in your backyard in Acupuncture at that time?" She said like, "Yeah, in a couple of weeks, I'll let you know." Cool. So she lets me know it's going to be the December 15th. I think it was a Friday or Thursday.
It was like a Wednesday.
Wednesday? Okay. Well, so anyway, so she told me that I was working at that time. I think I went to the gym and I was like, oh no, I had the yoga. So,
so you almost didn't even make it.
So I was telling Sarah, I was actually about to tell her like, "Hey, I might not be able to make it. I don't want to be rude and be late." But I texted her and she said, "Oh, you're good. Come anyway. We're just running a bit behind or late or something." So when I got there, I know I was late. So the best course of action I could think of is like, okay, don't make any eye contact with anybody. Just look straight and just smile and wave.
Well, so what was funny about you being late is the last spot left was front and center.
Yeah, that was very interesting. Yeah.
Front and center. So you got to be right in front of me, and we were a pretty tight space, so it's not like I could walk really far back. So of course I got to help adjust you a couple of times.
Oh, the yoga instructor right there when she was showing everything.
All the demoing.
Interesting. And then all of a sudden,
she
has some things. So whenever you pass, try to, let's say, try to get my posture right. You're kind of like
alignment,
getting some parts. I'm like, wait a minute. They has some connotations over here.
No. Well, it was like super fun. And towards the end of the class, we wrapped up. And
that was fun. I remember this.
Well, all I'm going to say is afterwards, I was like, let me introduce myself. And I was like, hi, I'm Alexis. Thanks for taking my class. How do you know Sarah? Because again, all I got was, we're waiting on my friend Sebastian. He's looking for love. And that was like the end of the story. And I was like, I have no idea what she's talking about. And so you said, I go to acupuncture school with Dr. Sarah.
Yeah, I went, it's Dr. Sarah, but for me, it was just Sarah. So at that point, we started chatting, I remember. And I think it was Sarah left at that time. There was a couple people there. She
finished, yeah.
And then it was funny because I remember this. I didn't know anybody, so you were talking to me, and I had like this side of my eyesight. I have something bothering me, and I was kind of like looking around, and it was this guy, and I'm like, oh, probably it's the husband, this guy, okay. So I was kind of like wrapping up. Yeah, so I was like, I was trying to, okay, yeah, no worries, okay, yeah, sure, oh, that will be amazing, yeah, okay, good. And I was like, oh, why is she not like, go? And I'm like, or maybe it's the brother. Cousin? I don't think it's the dad. So,
well, it was an ex who was hovering, but he left, thankfully.
So I did that.
So I got to keep talking to you. And I was trying to keep talking to you because I didn't want to talk to him. But, I love that you shared that you were an acupuncturist, and that was the second thing when I knew I was in trouble.
Oh my God, wellness, oh my God. Yes.
I mean, it's not every day that you meet a handsome acupuncturist, I'm just saying. And so, truthfully, I generally had at the time some male health coaching clients, and I also had male yoga students. Sarah was mainly taking women, and so I generally was, hey, can I get your number?
How convenient.
I know, right?
Let me get your number because of my clients. I remember.
So I was like, can I get your number to share with my male clients, since especially you have a focus in men's health. So that's how I got your number. And obviously, I'm not a very patient person, for everybody who knows me. When I want something. And so I waited, I went home, I ate dinner, I showered, which was probably about an hour later. So I waited about an hour, which is pretty good for my patience level. I was like, pretty good. And then I texted you. And
I remember that. I was like, okay, that was quicker than quick. Okay.
And I was like, it was really nice to meet you. And we just kept chatting, and I was like, how'd you get into I'm sure we chatted how you got into acupuncture, just random things. And you were like,
more random things.
Like,
random. Do you like to go and walk in the park? What do you like to do in your free time? What do you do? I'm like, okay. At least she likes to talk about stuff. So it was fun.
There's always when you first meet someone, there's so many things you can talk about, And I'm trying to remember what happened after that, but we texted that night, and you had said something like, if you ever want to chat more, we could get a latte or something. So we kind of ended there. And so the next night, I remember I went to a happy hour. This was Thursday with Whitney and Jimmy, and they always ask me about my boy life, right? My love life. And I was like, well, I met a really handsome guy at yoga, which is also not something you can say every day. Not a lot of guys come to yoga sometimes.
Not a lot of guys, that's true.
We attract a lot of women in our community, period. So I was just blushing over you or gushing over you, whatever the word is. And so I remember being really excited. And then Friday, when I got off work, I was going to go for a walk, and I was like, it can't hurt to just be like, do you want to come for a walk with me? So I texted you.
I remember.
Do you remember this? I was like, do you want to go for a walk?
I was finishing clinic that day. I used to work at the
No
medical
fear.
center.
No fear.
I like working at the medical center. I was like, kind of tired. It was a long day. Then all of a sudden, this Huchimama is like, hey, you want to have a walk in the park? I'm like, all right, I have energy. Let's do it. I don't care. I'm
The
tired.
text you least expected.
Yeah, I was like, I'm tired. I'll get energy wherever I can. I'm like, oh yeah, sure, let's go. So it was fun. We walked around.
Yeah,
for
we
a couple
walked around, got
an
a
hour or so.
latte. I think we got a latte maybe at La La Land.
No, I don't think so.
We got a latte somehow, somewhere.
No,
but then
we got a margarita.
we ended up at margaritas.
No,
we
but-
started with a latte, we ended with margaritas.
But that was very random because you were saying like, we can sit here. I know the manager. I'm like,
I actually
okay.
had just met the manager of Highline before that. Like, yeah. That's actually where Jimmy and Whitney and I had gone too. So I had literally just been there and the
No,
waiters
I think
like,
you
knew
said
me.
something like, oh, he's a yoga student or something like that.
He was Italian.
Oh, something,
think-
yeah, something
yeah.
like that you said. So, yeah, he came, hey,
My
how's
Italian
it going?
roots.
Oh my God.
We connected over that.
Oh my God. Yes, you're Italian. Okay. So he came and he's like, oh, blah, blah, blah. Hi, how you doing? Let me get you one frozen something. And then we shared that one. No, it took like 30 minutes for that one. And then he came by again. He's like, oh, wait, they haven't, okay, let me bring it to or something like that. It's on the house or something like that. And we were like,
So we
all
got,
right,
yeah, margaritas on the house.
perfect. Not
Chatted
gonna
all
complain.
night. You had me when you started showing me acupuncture points on my wrist.
Yeah, it's like I was showing you, like, seriously, like, this is how it works. This is how.
How convenient.
Yeah, it was. Well, I'm gonna show you in your legs and be like, this is like, so sexy, like, but this.
Uh-huh.
No.
Well, what I remember was your touch was also really soft. So you were showing me acupressure points and I was like, wow, he has really soft hands. And I'm like a stickler for soft hands. And I was like, oh my gosh, who is this person?
Of course, I have to have at least decent hands if I'm gonna be touching the patient's body. They don't want any,
So,
like, with
rough.
hard hands and be like.
I mean, to each their own. But I will say, fun fact about, acupuncturist, however you say that plural, is generally they have soft hands. So interesting fact.
And then all of a sudden I remember, oh my God, a bug. And I was sitting like literally like across.
I don't like
oh
bugs.
my God, a bug. And then you conveniently come and sit next to me. I'm like,
I got closer.
I'm like, checkmate. You've done wrong.
I was having a great time.
Yeah, we had fun.
And then we were walking back to my car and we had a moment, which I loved. And
What
then we had maybe
Mine
our
is a
first
moment.
kiss.
Okay. You can say
And
we
I
had
was
a
a good
first
girl
kiss.
and I went home.
That's not how I remember.
Yes.
I remember that it was, I like a gentleman. I opened the door. Yes, you see, you leave a lot of things. I opened the door and I'm like, okay, it was nice seeing you. Thank you, all this stuff. You went in your car, like
I
literally.
I set my purse down or
No,
something.
you literally went in, like, okay, half of your body went in, and then all of a sudden you went back out and I'm like, ugh.
I don't
Oh.
even know why, but yeah, I just like felt like
That
kissing
happened.
you.
So I was like,
Okay. But yeah, this isn't about me. So let's not go there. But yes, I maybe initiated that. And then
That was cute.
it was cute. So this is like Friday. Saturday morning I was leaving. This was December, remember?
Mm-hmm.
Christmas time. People are leaving for the holidays. I was leaving Saturday, which is part of the reason I wanted to ask you on a walk, because I knew I wasn't going to have another chance until I came back like a week or two later. So Whitney was supposed to take me to the airport the next day, and she's headed over, and I'm looking at my flight, and all of a sudden my flight was canceled out of the blue. I think this was the year Southwest was having problems keeping up after COVID at the holiday time. And so like not raining, nothing's happening, but like my flight gets canceled. And I was like, okay. So I rescheduled it for the next day, and I texted you and I was like,
Yeah, I
hey,
remember.
so I can't believe like my flight got canceled.
I was like,
Convenient.
the power. Yes, I have the power.
And so you were like, well, if you're not busy, I'm going to a Christmas holiday party with some friends if you want to come with me. So that was December 18th, which I
Yes.
call kind of like our real first date, and
my
that's the
God.
day we're going to stick with. So
Okay,
December
I
18th
remember. Oh
is
my
like
God.
our first date. You took me to a Christmas holiday party, and I was giddy over you the rest of the time that I was gone. We were texting, came back, celebrated New Year's together, went on a couple more dinner dates at the beginning of the year, and after that, it just
Yeah, you took me to meet your parents after 2 months on a ski trip. I'm like, I didn't know how to ski, and all of a sudden, like, I'm skiing.
That
I'm
was
like,
one of my favorite moments of 2022, was when we went on the family ski trip and you came.
Yeah, I was like, what is this?
And Jen came.
Okay.
Sam's friends came. We were with family, cousins.
It was very fun.
It was
I enjoyed
super fun.
It was super fun. Except the part you start laughing at me at a certain day.
We had fun teaching you how to ski.
Yeah, except when I have constant cramps and you were just laughing at me every time.
Sometimes you just have to laugh instead of cry. I mean.
Oh, yeah? No, I was doing the crying mostly. You were the laughing one. Yes, I remember that.
So I love our journey. And that's how we met. It was super fun. It really started, I mean, it was like almost like, I hate to say like love at first sight, but you basically just dropped out of the sky.
Without wanting.
So my advice in general is, of course, just, you know, I felt like I was doing something that was very me, like authentic to me, teaching yoga, something that lights me up, and that I met you in a moment that I was being myself. So my advice to people is always to be themselves, and that will attract the right people into your life and the people that are meant for you.
Obviously.
So, yeah.
That's a good tip.
Yeah. Okay. And we'll have to share more relationship tips maybe next year. So we'll have Whitney come on and talk to us.
Okay. Can't wait.
So let's talk more about you. Can you tell the audience how you, just growing up, how you got into medicine and how you ended up in acupuncture?
So, yeah, when I was a kid, to tell the truth, I always had some fascination to know how things worked. Not only human, like anything that I can think of. Like, how the things like sit, or a chair, or a plant, how things work. So I think I was looking at my dad playing tennis, and I look how he was like playing, and I was like, that's cool. How our body's able to do that? Like, how? So that kind of snowballed into that. And then when I was in high school, you know, you have to pick the kind
major,
of
yeah.
So first of all, I was terrible at math. I was physics, math. I just sucked. Like,
wow, I'm shocked.
Yeah, so bad.
I'm really good at math. I could have tutored you.
Okay, I bet. Yes, you are. So I was good actually at biology. Chemistry, I was doing okay, but anything that has to science in general like that, I was good. And anatomy, I was like good. And actually one of my first anatomy classes was in high school, so I got a little bit of a taste. So after that, my dad is actually a medical doctor, and he's actually an acupuncturist, but he was not the reason why I get into acupuncture. So my brother and I, we both end up studying medicine. So at one point, we just were talking with my dad, and with my brother, we're just always joking around, like, you know, how is our dad not able to perform this Western medicine that everybody's been talking, and all of a sudden he is was successful at that time when we were still studying and we were in med school. He was successful getting patients, and we were jokingly at some point that, hey, so either this medicine works or our dad is a drug lord, maybe? I don't know. So yeah, we were joking around that. So fast forward, I end up med school, thinking about like what I'm gonna do, because as you know, once you graduate from med school, you have to do certain things in order to
like
pick,
residency.
Yeah, you have to pick whatever you would like to do the rest of your life. In this case, residency, whatever is OBGYN, pediatrics, internal medicine, surgery, and whatever you want. So I was doing that, and then obviously graduated, started to do this residency. And then when it was time to come here, I just felt this frustration of it's not enough, because I was looking that I was still doing the same, just prescribing patients things, pills, same things, same tests, same lab works, same imaging, sometimes getting somewhere, sometimes getting nowhere, sometimes just referring out. So it kind of gave me in that place of, all right, so is this going to be...
Am I really helping people? Yeah.
Yeah, so that got me in a place of, all right, I mean, it's going to be nice. And of course, my brother was already here in the U.S.
Well, that's part of the reason you wanted to come over, because your brother had come over.
Yeah, so he was explaining me kind of the process, how is it going to be. And I was like, okay, fine. And yes, you start to earn money, and we were like, okay, perfect, that's cool. So in the end, I was supposed to come here to Houston because my brother was in San Antonio. So I started to look into
at schools.
all the, like, to come here because there's the Kaplan where you study to take these tests that are called the USMLE or the steps in order to pursue your residency. So before all this, before coming here to the US, I had an injury. I was doing CrossFit back in the day. So I had a shoulder injury. And the person that actually told me to get acupuncture was my dad.
Aww.
Because I tried everything. Like whatever I would tell a patient to do, if they had the same thing, I tried it. Just for the sake of, let's see how good of a doctor am I. So I did everything. And I'm like, this sucks.
I still don't feel like it's getting better. Yeah.
Yeah, it was like, So my dad is like, let me treat you. Just come. Just try it. If it doesn't work, that's fine. I'm like, all right. So it's not that I was afraid of needles. I was like, meh, all right.
So you hadn't even had your dad do acupuncture on you up until this point.
I remember when I was a kid, he did it on me and my brother at some point. We were like,
oh, okay. Oh my goodness.
Yeah,
okay.
but
So a couple times.
Yeah. Other than that, we were pretty healthy, to tell the truth. We were like never needed anything. We never visited the doctor or anything like that. We grew up pretty healthy now that I think about it. But anyway, so I tried acupuncture. My dad did it, and I'm like, oh my God. And my dad has a really tough hand with acupuncture. He's really
heavy. So
heavy.
I think you're tough. He's tougher.
Oh my God. My dad will be like, he will make you scream to the heavens.
Okay.
Bloody
Hopefully
murder.
not. Hopefully not that. We
But
don't want people to think that's what acupuncture is about.
No, it's not that. But my dad knew that I needed that kind of.
And you're his son.
Yeah, no, and he wanted to show me what it's about. So he treated me, and after 3 days, I was like, no. It's been already 2 weeks after I first initially injured myself. So no, I think it's the time and all the things is starting to work.
But I was feeling better.
And yeah, it was feeling better. My mobility was better. And I was like, should I go back to train? I trained. I kind of felt it, but it wasn't bad. Then my dad told me, come once more, and that's it. I'm like, all right. You got my attention. All right. So I went there. He treated me again. It was good. So I'm like, all right, there's something here. And I remember that before coming here, that's when I asked my dad, hey, can I shadow you for a couple months maybe? I'm like, sure, that's fine, come. So I remember till this day what he did. So that's when I switched. So we were this patient in his clinic. This patient had migraines for like 10 plus years or something like that.
A lot of people have.
Yeah. So she was miserable. Like weeks, probably she couldn't work. She couldn't attend things. She missed her son's graduation or something like that. So I remember she was talking about all the things she's being prescribed. So she was enlisting all the things, right? So obviously new young doctor, I was like, yeah, I've given her that. Yeah, probably the dosage is not good. Probably this is not good. I would have switched this medication. So she was going on the list. And then I was, why she didn't get referred out to a neurologist? She told us she got referred to 3 different neurologists. I'm like, okay. Maybe they sent this medication. And she was continuing with the medication. So she ended up, all the medication that I would think that I would send that patient and all the things that I would have done with that patient, I'm like, oh, wow, okay, what now? And I remember my dad was in like kind of like a big chair, like James Bond, like kind of. So he turns around and he looks at me and he's like, what now, doctor? And I was like, well, try to refer out to another specialist. And I remember the grind in his face,
the grin?
the grin in his face, like just smiling. He's like, that's why I'm here. And he turned again. I'm like, okay, cocky, I like that. So he turned and he started treating this patient. And I remember after a week, she said like her migraines, he only had one.
So he started treating her with acupuncture.
Yeah, with acupuncture for
migraines.
the migraines, and it got well in 1 week. So then I started to put one and one together. I was like, okay, work for me, work for her. I mean, there must be something ongoing.
Really curious.
So when I was coming here already to do my steps, I was like, no, you know what? Dad, I'm just gonna go and do the acupuncture. He's like, hey, it's your life. You do whatever you want. I'm like, cool.
Aw.
All right. Of course, he was kind of proud that he never kind of talked about it, but.
So you came over in this, what's the Houston acupuncture school?
It's called the American College of Acupuncture and of Oriental Medicine. Acupuncture and Oriental Medicine, ACCOM.
We'll drop the acronym in the show notes.
Yeah. So anyway, I came here in 2017, got done with my master's, 2019, 2020. Started practicing a little bit with some professors of mine, got my doctorates. I finished in 2022. Then I keep practicing. I got my doctorate there, and then I started practicing till...
At Templ.
Yeah, Templ with Dr. Sarah. Yeah.
Where we met.
Oh
We've come full circle.
Full circle. Oh my God. Lion King all over again. The circle of life.
I love it. Well, I think it's really cool. Do you ever think it's funny that you ended up like your dad with the medical
quite
and
interesting.
the acupuncture?
Yeah,
Did you ever think? Sometimes we end up like our parents.
Really? No, not really, because we're also talking with my brother. He was actually going first, OBGYN. I'll do the pediatrics. We'll open a clinic like the brothers.
That would have been so cool.
But actually, I ended up liking more the OBGYN at that point. I really like to, deliver babies and all that stuff. It was cool, but it was really stressful. Then my brother was more liking to the surgery, so he went to that route. I was thinking about pediatrics, OBGYN. I was picking more pediatrics because dealing with the pregnant ladies sometimes is
stressful.
More than stressful, is very demanding as time-wise. Because, well, in Ecuador, you have to write down by hand things for the mom and the baby. And that itself, literally, I'm not kidding you, the paperwork you can just do by 1 hour. It will last 1 hour. You'll just handwriting, doing everything by hand for 1 hour. And you haven't even done anything for the patient yet, just because of paperwork.
Yeah.
So that's why I was like, no. Yeah, paperwork can kill those dreams for sure.
Well, so now, you wanted to get into pediatrics and OBGYN a bit, but now what are you passionate about helping people with? Maybe talk about your niche.
So right now, as acupuncturist, is more about, of course, everybody knows that acupuncture treats the pain, all the pain.
Yeah, like what is acupuncture and how can you help people with it?
And long story short, is insertion of the needles in certain places, but it's not like dry needling, because a lot of people confuse dry needling with acupuncture, which is not the same.
We covered that with Sarah.
Yeah. So the thing is that with acupuncture, we have these meridians, okay? So if we insert these needles in these meridians, it will heal. But for example, as I like sports medicine, it has a different connotation. I'm not only going to do some local points. Let's say that the person has some pain here in his leg. I'm not going to do, it hurts here, needle here. It hurts here, needle here. No, I'll use those meridians and maybe see what that person is lacking. Is it more blood deficient? Is it chi or energy deficient? Is it more about the fluids that he has in him or her? Like something around those things. And if something more obviously local, yes, 100%. But what I like is that I put the movement and the kinetic of whatever they were doing. For example, if it's lifting, throwing, pushing, pulling, whatever it is. So I work with that motion with acupuncture in order for bring relief to that person, so they can go back at what they were doing in the first place. Because my goal is for them to keep doing what they were doing instead of telling them, you need to stop.
Yeah, quality life.
Yeah, give them that quality of life.
Well, yeah, so you hit two things there. So with acupuncture, you don't necessarily, you have more than just the local. You can put needles in other places along the body at different meridians to help other specific like body parts.
Yeah, like you have distal points. Those are called distal points.
Yeah.
So for example, there are points for, let's say, the head that are in your foot, and vice versa. So, or you have extra points, as we call them. They are not necessarily in any meridians in Chinese medicine, but they're in different parts in the body that you can use. For example, I think I've done for low back pain, you have one right here, in between right here. So
top of your hand.
Yeah, so Chinese medicine also works with a lot of
How the body is connected.
Yes, correct, with the universe, and how everybody has this little human inside their own bodies or represents different things. So, for example, the animal, not theory, but for example, if you see your hand, as I was telling you, this is like a dinosaur. So these are the back legs, these two are the front legs, and this is the neck. And all this is the spine. So that's why these 2 points can help with the low back.
Interesting.
So those little kind of things they have. Or the homunculus theory, that is in your ear also. You have a little human. If you put it like a fetus and you have like the spine, the head, the lungs, little things.
And that's
like
how
that.
you can
And
find the
that's how-
points on the ear.
Mm-hmm.
And that probably helps you remember them too. Yeah.
Yes, for sure. That's helped.
I also like how we've talked about if you have anxiety, and that's technically like heart, right? But your heart is connected through to your veins into your wrist. So a lot of times for anxiety, you can press the inside of your wrist to calm down, or you can do needle points there as well. So
Correct.
that's another example of like something you've done for me that's connected.
Yes.
Yeah.
Again, that, for example, is more for the mind. But there's something, for example, for digestion that is right here on your foot. So it's like digestion, how is that connected? So those meridians pass at some point either through your digestive system or on the side. So that's how we kind of use the distal points in order to help something that is far away. And obviously we have the local points, and we have acupuncture points that are maybe near the local point that is struggling or needs some help. So that's how we do it. We connect those two.
Well, and I also like that because people may be sensitive in different areas. So maybe someone doesn't want needles on their stomach, but they're having indigestion. So you can use the distal points. And like maybe I don't like needles on my wrist. So you can do like a different point, right? So everybody's a little bit different. And that gives you the flexibility to customize the treatment to the person, especially if they're scared of needles.
Oh, yeah, that's a lot. Oh, and we have a lot of patients that hate needles. You can just see them like, they're like so hard and so like
Tense.
resisting to not look at the needles. They're like just like that, like so hard. I'm like, no, just let your body like a heavy rock, and then you just see like their muscles like, ah.
Well, acupuncture will make you relax because it's calming your nervous system. So
Yeah.
at some point they can't resist it anymore because it'll shift you into parasympathetic and maybe even put you to sleep.
And that's the thing we have. Well, my patients usually tend to go to sleep. They take the nap, and sometimes it's like, okay, I'm here, I'm ready, let's do it. Time for my siesta, time for my nap. I'm like, let's do it. And that helps because sometimes it's not enough what we can get at home versus what we're doing over the day. So sometimes, yes, acupuncture can help with stress management and a lot of things, but it also helps recover that energy that we spent throughout the day with those little 30 minutes, 25 minutes that we have. So I like that.
Yes, me too. So at Templ Wellness, what are the most common things people come to you for?
So, all right,
Just
sports
name-
medicine,
yeah.
sports medicine, of course. Pediatrics, we've been getting a couple here and there.
Couple kiddos?
Yeah, a couple kiddos. One of them is actually Sarah's.
Aw.
Yeah, he's super cute. Shout out to him. He's Sebastian as well.
Yep, baby
Yeah,
Sebastian.
Baby Sebastian. So, pediatrics and men's health, actually. I have a couple of patients that actually come just for whatever they need. And men are not notoriously very big on telling that
Self-care. Yeah.
something is wrong with them, that they need help at some regards. They only come when it's already too bad. Like, oh my God, it's so bad I cannot, I don't know, my low back pain, my neck, something is wrong. That is when they come. So I try to tell them that it's not bad for you to feel pain, but it's bad for you to just work.
Not seek help.
Yeah, seek when the pain or when something is wrong. It's like having the car has a dashboard that has some lights. So if one light comes on all of a sudden, what do? Let's say the gas light comes on. What do? You go and put gas. So if your body is like that, if a light comes on, your dashboard is your body. What people usually do, I'm just gonna put like a sticker there. I'm not looking to that light, and then all of a sudden, all the dashboard is lighting up. So you have to take care of those lights. So that's what I tell my patients. It's like, hey, something's wrong. Take care of it before it evolves to something even worse. And men, unfortunately, are not, me included. Sometimes we're very stubborn, and doing things, changing things for our
Health.
more than our health is our own well-being, because we want for everybody else to be taken care of. Then we'll be like, okay, everybody's taken care of. Okay, now it's me time. So that's what I would say.
I think that's really important to note, that it is important for men to also be able to seek help and take care of their well-being, and that they can go to acupuncture too. And so I think that's really cool that you and Sarah both work at the clinic, so men and women both feel welcome.
Yes, completely. We obviously sometimes we don't get the cases that we would like. Of course, I get fertility patients, treat fertility patients on women as well. But when we get these cases with men, we try to make them feel that, hey, this is not taboo. If something is wrong, hey, it's okay. It happens.
I'm glad.
So I've seen some things that it's getting more common, especially with men, especially younger men, I would say in their mid-30s, mid-40s. I would say is something that I can see more and more often in clinic, especially with testosterone and maybe some, for example, erectile dysfunction or just stress management is just...
Because stress could be causing all those things.
It is. But it hits really hard to these people. And they're very young to be suffering from all these things.
Well, I always say we're in the 4th largest city here in Houston. And so stress is very rampant because we're in a go city. So, a lot of people need help and need stress management.
Oh, yes.
Including myself. Yes. So I always seek out treatment from you or Sarah.
I can see that here. Everybody's like, wait, where are you going? What the hell's wrong with you? Yeah, everybody's like...
We're not like that bad.
Well, in general, everything is go. So I know when you're just watching me be like, oh, chill.
You help calm me down. You're very chill. Yes.
I'm like, They're like, what are you doing?
Why aren't you doing anything? Why are you not freaking out like me? I'm just kidding.
So it's fun to just have that moment to know that you're doing something good for yourself, even if you're not doing anything at that point.
Yeah.
But that doesn't mean you have to take care of yourself.
And just something to note about the acupuncture too is it can help things you've covered from physical to mental to emotional. And so you can treat a variety of...
A plethora
of dis-ease, right? To say. So it's always, especially if you think you've exhausted all your options before something serious like a surgery, it's a good idea to come see a functional Chinese medicine doctor that can
and that's
see
usually
if they can help you.
What happens. I've had some patients that have come and they think getting acupuncture will be their last resort before surgery. And once they start working, they change their mentality and be like, why didn't I come to acupuncture
sooner?
Before?
Yeah.
So they change that. So acupuncture in Chinese medicine has been seen as a preventative medicine. It's been seen as, and people think preventative, oh, that sucks. No, that's what we want. And as I told you,
it's like eating well and working out. It's
correct.
Part of that lifestyle, healthy habits.
Is just the fact that, as we were talking once, that well people create well societies. So I'm not gonna have to spend my time chasing out the disease, but I'm gonna have time supporting the healthy individual. So what I want
well
is
people
that.
Create a well society. I love that.
So yes, I know. So,
quote of the episode.
Yeah.
Today, I really wanted to shout out the complete probiotic from Sakara Life. When I say complete, I mean it's got prebiotics, probiotics, and enzymes. It's a triple threat that you can rely on to keep your gut happy. And it's been a lifesaver for me around this holiday time. The prebiotics are sourced from papaya and alfalfa, and they provide food for the probiotic bacteria so it can grow and crowd out the bad bacteria in your gut. Then there are the 11 diverse strains of probiotics to help with digestion, immune function, and things like clear skin, which we love. Finally, the digestive enzymes help your body break down food, ease bloating, and increase nutrient absorption. I personally love to take Sakara's complete probiotic after dinner, so at night it can get to work whilst I'm sleeping, and I'll wake up with a flat, not bloated, happy stomach. Sakara has beautifully crafted meals, snacks, and supplements made from quality ingredients that you can trust. So check them out at sakara.com to snag that probiotic and use code XOAlexisM for 20% off your entire first order. That's XOAlexisM at sakara.com. So the other thing too that I can think is even medication. So before surgery, but also if you're on medication or before you get on medication, like say you're having trouble balancing your hormones, you could come to an acupuncturist. If you're thinking about getting on anxiety or depression medication, you could come to acupuncture. And instead of taking that medicine every week, you could get a weekly acupuncture session to help regulate your system. So It's just, there's a lot of people that are moving away from pharmaceuticals per se.
Completely, yes.
For things that can be treated with a lifestyle or
it
a
can
more
because
integrated medicine.
As you said, like nowadays everybody's just go. The mental health is going down the drain. Men and women, everybody's with either a sleeping pill, anxiety pill, or all of the above pill. So, and especially young professionals right now. Yeah, as we know, as older you get more problems. But nowadays, more the young professionals to early 20s, everybody's just anxiety driven. So my patients, when they come, they have a lot of pills. They're taking like 4 or 5 pills for anxiety, depression, sleeping, acid reflux, and some pain they have here and there. So I'm like, you're only 30 and you're already having this amount of medicine. So the thing is that as we start the treatment, as I'm gaining terrain, then depending each case, because I individualize every patient, is try to taper them off of whatever medication they're doing. So for example, anyone that is having an anxiety medication is not about, don't take it, it's gonna be okay. No, I have to taper them off correctly, because that's how it's done. So, and how research shows. So if I'm gonna give them some Chinese herbs, okay, I'll start with Chinese herbs while they're still taking one, and then we increase one and then decrease the other one until they one day come and be like, hey, I didn't take my medication today, I feel good. All right, don't take it tomorrow. And then it goes like that, a little domino effect. And then one day like, oh my God, I feel bad. Do I need to take it? No, don't take it. Take your Chinese medicine, you'll be fine, until we get that out of the way.
Well, and you're special in that regard because you have the MD background and the acupuncture Chinese medicine. So you're able to really utilize both skills to help a patient. And so I guess one of my last questions for you in terms of medicine is, when should someone seek out Eastern versus Western? Western being more, pharmaceutical surgery, and Eastern being more Chinese.
Western, as you said, it is more symptom, is the illness, versus the Eastern is more about the individual.
The root cause.
The whole.
Oh, yeah, the holistic.
So, in that sense, for example, I remember when I was in the hospital, it was more about, the patient in room 42, bed 6, the one with a, pancreatitis. You were labeled as the pancreatitis or XYZ disease. But in Eastern is more, you have a pattern of signs that you have. For example, if you're hot and cold, if you're more drier or you are sweating profusely, you're tired, your digestion, if you're more constipated, you have loose stools, things that usually you don't get asked nowadays in the Western medicine. Nowadays it's like, what are you here for? Headache? Okay, here. Peace. That's it. Call me in 3 days.
I agree. Sadly, Western medicine has shifted more into just treating specific symptoms than the whole person or the root causes. But can you call out the pros and the benefits of each as well? So what are, when is it good to go to Western?
So Western is more of the, let's say, the flash treatment, the specific acute whenever it's happening. Say pain, say anything that just happened at that time. Something that requires a little bit more finesse, that has been going on for quite a while. Say you digestive problems, migraines, something that is still there and still taking the medication is not going, then you go Eastern. When it's something more acute, something that happened recently, that is you're able to treat it with a couple pills, that's when you will go the Western, something right there. When you don't have any other, let's say, history with any disease, that's when you can use the Western. Well, Eastern, yeah,
it gets really confusing really fast.
Yeah, so well, the Eastern, you can use it whenever you have any type of chronic issue. Why? Because, of course, we need a little bit of time to get ahead of the game. Like we're the tortoise versus the hare.
In the race.
Yeah, so that's why we start small, we start slow, then the benefit will be big.
Right, and of course, another thing for Western is emergencies, right?
Of course.
Like,
That's,
you cut yourself, car accident. I mean, of course, even like
I don't think
OBGYN.
someone with the broken bone would be like, can you fix this? Can you put a needle here?
Yeah, but acute all the way to emergencies. And then
Mhm.
if it's something more lifestyle or chronic, Eastern
Correct.
is, I'd rather go to you
Yeah.
guys before I go to.
Correct. Something that you're
Western.
able to just keep it going.
Yeah.
Mhm.
So we're running out of time, so we'll have to have you back on. So again, everyone can find you at Templ. And
Yes.
again, a couple quick shout outs for things y'all have helped me with are personally stress, which we highlighted, indigestion, bloating, stomach pain, which can be connected to the stress. We can do some stomach points, some distal points. You've helped me with balancing my hormones. That's why I started going to the clinic in the first place, when I was trying to regulate my cycle. And again, all connected, stress and other hormones. And also my neck, shoulder, and back pain. So that's a physical example where I'll get tightness or tension. It could also be from mental stress, but the physical and the mental all connected. So those are a couple things I've gone to y'all for. So people can go check you out and find you at Templ Wellness. And I did want to shout out to refer WellnessForHou for $10 off their first time.
Yeah, the plug, of course.
To go see y'all. So let's wrap up with a couple wellness things.
Mm-hmm.
What are a couple wellness things that you do for you
Okay.
in your routine?
My routine, well, as you know, for me, I do intermittent fasting. I do.
Oh, yeah, we could have a whole episode on
yeah.
that.
You don't. I don't eat breakfast. Yeah, why don't you eat breakfast? I want my breakfast. I'm like, I don't eat breakfast. But then again, I try to do that intermittent fasting.
That's one.
Have bigger meals throughout the day. Go exercise, gym. As you know, paddle. I've been doing a lot of paddle with my friends. So I don't like pickleball. Not the same. I didn't like pickleball.
Exercise is important.
Tennis and walks with you. Or just walkies overall for health. And doing things.
Experimenting with diet too.
Yeah, that's another thing. As you know, I'm doing the carnivore diet right now. Try it for 30 days. Let's see how that goes. And yeah, doing your own hobbies. Well, in this case, my own hobbies. You know, I like playing my video games, doing certain things on the side. That's how I grew up.
You decompress, yeah.
Yeah, and that's how also I learned English, by doing those things.
Yeah, video games, watching English movies, subtitles, music.
There you go. Yeah, you paid attention. Good job.
Yeah.
Good job.
So yeah, definitely all good things to share with people to do on a regular basis. Last but not least, what does wellness mean to you?
So wellness for me, actually, as you know, is not only the absence of disease, but is also the relationship that you have, the environment, the people, especially to oneself. If you love yourself, people will notice it, and they will be grateful to have you in their circle, and that circle will be good for, I would say, the rest, the environment, the rest of the community. So that will create wellness overall.
Society. Oh, that's beautiful. I love that. Well, thank you, Sebastian. Where can we find you? Shout out where we should follow or come see you.
Well, you can follow me at dr.jsbonilla. And you
JS Sebastian?
JS Sebastian, B. Sorry, I don't, you know, me on social media. And
I'll drop your Instagram handle.
You just drop it anywhere. And you can find me in Templ. Just drop by and say hi. A lot of people just come and say hi. Yeah, I love that.
Awesome. Well, we'll put those in the show notes. Thank you so much for being here. And
thank you for having me.
Now we can go find a dinner spot.
Oh, there we go. Yeah, I'm starving. Let go.
Woo! Thank you.